Hi, my name is Faith Sexualty. I am Chief Certified Registered Nurse Anesthetist here at iOS through Hip Anesthesia, and I'm here to educate you a little bit on what to expect on the day of your total hip replacement. Now, regardless if it is a lateral approach, direct anterior approach, or a MIS approach, your anesthetic is going to be the same. We expect you to show up about 2.5 hours before your scheduled case. This will allow us time to get you registered at the front desk, bring you back to pre-op, get an IV. One of our anesthesia team members will come and talk to you about your medical history, your medication list, physical assessment, and so forth. Once you sign your anesthesia consent, there's no reason to stay sober. We are going to give you some sedation to kind of help cut the edge off a little bit. Now, with that sedation on board, things get a little blurry. You may or may not really remember much afterwards, and that's okay. I am going to do 2 shots to numb up your hip. The first one is more for joint pain. So it starts kind of in the joint area and is more in the pelvic area where we're going to be doing the injection. It's very quick, very simple, in and out. That will cover all of the bone pain that you'll have for this. So your second injection will be more for incisional pain, and it'll just be a little bit more what we call lateral part of your hip here, and it'll be very superficial. We call that the hip holster shot just because if you were wearing a gun holster, it covers majority of that skin area that a gun holster would be placed at. Regardless, we'll get these 2 shots done. 24 hours is typically how long they last. Now, we have had patients come back to say about 1.5 days, sometimes 2 days. If it's beyond 24 hours, more bang for your buck here. But regardless, we're just gonna say 24 hours. This way, it kind of helps bridge you over to oral pain medications a lot smoother, and it gets you over the peak of the inflammatory response after surgery. That is for post-op pain. Now, for the actual surgery itself, we do the spinal, where we just sit you up at the side of the bed in pre-op. We can give you more sedation at that time if you so desire. But regardless, the worst posture you can give us, the better for these spinals. So meaning rounded back, slumpy shoulders, chin to your chest, and then forehead to our chair massage table that will provide for optimal positioning. Once we do your injection, we're gonna lay you back onto the bed. Give that about 5, 10, sometimes 15, 20 minutes for your spinal to set up, and you're gonna be numb from belly on down for the next 3 to 4 hours. That'll get you through the surgery, and with that spinal on board, we'll head back to the OR, and that's when we hit you with heavy sedation through your IV the whole time. So you'll be sleeping and snoring during the case. It is not considered a general anesthetic where we put a tube down. Plan B is always a general with a tube. Both are very safe anesthetics. It's just that a general is more drugs for your body to get rid of. So if we can avoid having to do a full general on top of your spinal, we will. But regardless, you're gonna get your new hip. We're gonna head to recovery. You're gonna start slowly waking up. Your spinal will start wearing off, and your 2 injections will already be in place. So you should wake up fairly comfortable. That is our goal for you. If for some reason you do have a hot spot or some achiness anywhere, we can supplement that with some oral pain medications or IV pain medications. We really feel like a well-oiled machine here at iOS, where you're not just a number, that we will individually care for your needs, and we want to make sure that you're comfortable throughout your stay, not just in your pre-op, intra-op, but your post-op as well. Feel very honored for you to come. We're excited to see you and be a part of your successful journey here at iOS.